start.
A very good evening, Dr. Liza Consultant. I think it's a pleasure to have you here at the Clinic of Pain Management with Dr. Rafeek. I think since pain management and anesthesia is vital in integral medicine, it is a pleasure to have you here today. Dr. Liza Consultant, who is having affiliated with the Birmingham, UK community and having her MBBS, DA, FRCA, FFP, MRCA, who is currently a consultant in anesthesia and pain medicine. Very good evening, Doctor.
Thank you very much. It's my pleasure to talk to you and your dad, Dr. Rafeek. I'm very pleased to be here on this auspicious occasion.
I am very glad to meet you, Dr. Liza, because your husband and his father well known to us a couple of years in the Kingdom of Saudi Arabia. So you came to see our country as a beautiful island, so first time. So I come across to you as you are involving as a pain management. It's a part of our integrated medicines and anesthesia. I think few questions will be very helpful to the community and the way of patients who are suffering. So I wanted to little bit eliminate that part. One is that what do you think about that alternative complementary in your country? How far is related to your field with the pain management? People are interested or how they are going to seeking the treatment.
First of all, my visit to Sri Lanka has been excellent. My family has thoroughly enjoyed and we hope to visit Sri Lanka again.
Yes, welcome.
Thank you for this opportunity to share my views on different sorts of therapies in pain management. My background has been with medicine as a medicine with background in medical college and my time in anesthesia and pain medicine. So my interaction with alternative therapies, complementary medicine for pain management may not be as much as yours, but I definitely do believe there is a role for this in pain management.
Thank you. And I want to know some little bit more on deeper. Is a pain management you are giving as a pain medicine as a relieve the pain and ache and pain. So that's what I want to know. Whether you are every patient you are giving the painkillers or you are managing with the therapeutic way.
So the first and foremost would be when we assess patients, we take a detailed history of their presenting complaints and how much their pain interferes with their physical function and social function. So we, as you may already be well aware, is that we look into the biopsychosocial model of how much pain affects them and how much their biopsychosocial model experience affects their pain journey. So therefore, we tell patients to not expect pain relief, but to expect management of pain. So we never promise them that pain is going to be relieved, but there is no cure for the pain condition they have, but we want them to help them manage the pain better.
Yes, doctor. I appreciate your point. Nowadays, high dose of the high strength of the painkillers affect the liver, kidney, long period chronic cases. So that time of the cases comes, how do you manage with the, so that time the patient also, I don't want these things, I'm trying to away from nature where the world is coming or not.
Yeah. So there was a time where there was a high reliance on opiates for pain management, specifically chronic pain. That has therefore resulted in, as you may be aware of, the opioid endemic in America, which is not so much in Europe or UK, but it is well aware that opiates can cause damage for chronic pain management. Therefore, when patients are on high-dose opiates, we try and advise them to come off it, withdraw the medication dose, and then to discontinue it. We don't advocate opiates for pain management, chronic pain specifically. but we do have modulators for pain medicine, such as the tricyclic antidepressants, gabapentinoids, and other sort of antidepressants which we can actually give patients to modulate their pain experience, which I feel has got much of a role in pain management than opiates or other kinds of pain killers.
Fine, thank you. But did you heard about your field? There are some of them are very interested to do the acupuncture to relieve the pain, but not for everything, every cases. There are selected cases can be managed with the acupuncture, electroacupuncture therapy. Then some supplement. Do you recommend also that a part of your view?
So my experience in the National Health Service in the UK has been that acupuncture has been in and out of the national sort of NICE guidelines, which is actually giving us enough evidence to support acupuncture. So there has been a stage where acupuncture was supported for chronic pain management, and then there has been a stage where acupuncture was not supported.
Yes, of course.
But currently, in the last 5 years or so, it has come back to a stage where we can offer acupuncture for chronic primary pain.
Very good.
Which means if they have myofascial pain, it can be helpful. It is about giving the patient a trial of acupuncture to identify if the patient would benefit. If they do benefit, it can be repeated.
Fine, thank you. That's a good idea, integrated way of medicines.
So, Doctor, I just have two questions that I was thinking on, looking at the youth of the generation that we come across is, we do see at the moment the kind of number of allergic reactions encountered is quite high for various reasons, and there is a group of people who do fall under allergic reactions, not as much, but maybe a small community for anesthesia as well, if I'm not wrong. So is there any methodologies or strategies that you all encounter into this section?
So I'm assuming when you say allergic reactions, are you referring to adverse reactions that the patient experience to a medication?
Yes.
Okay.
Yeah.
So that is quite common with most medications we have. There isn't any medication, I would say, other than maybe paracetamol, which patients wouldn't have an adverse reaction to. So generally, when we start a medication for pain modulation, let's say, we start it at a very low dose because we don't want the patient to be put off by the side effects. They will experience a side effect, but I warn them to say you're going to up-titrate the dose over the period of weeks. And then you come to a dose where it is minimally effective, meaning you're able to manage the adverse effect and you're able to sort of tolerate that dose. You continue on that dose for about 6 weeks trial, 4 to 6 weeks trial, and if then you notice that your quality of pain is better, your pain experience improves, then you continue on that medication. So in that period where you're having a trial, if the adverse reaction is something that they cannot tolerate, then they discontinue the medication. So generally that is the way we expose patients to different kinds of medication.
Is if you are to describe a sentence, a sentence or two, the connection between anesthesia and pain medicine, or this being embedded into the alternative medicine, how would you describe it in 2 or 3 sentences?
I think there is a role for us to work together. Of course, sometimes having sort of specific colleges like anesthesia or rheumatology or medicine kind of makes it more like delineating different medicines from interacting or having an interface. So I think working together when you get an opportunity to sort of network with people actually helps, because in that way not only does it help improve your sort of knowledge of what you can offer patients, but also helps patients have a better experience so that everything is there that can be offered to them, rather than saying this is all I can offer, you can go and try someone else if you wish to. I think it's important that we work together.
I think your view is fantastic, and you are giving the well set knowledge, and it's having an integrated work is very suitable to, because we have to understand as patients, we want to help them to get back. That's our main motto. So whatever you give, there is a lot of various therapeutic, various medication, the patient quite well and happy. That's what we are looking for it. So what is your other questions, anything you want to ask from us?
Yeah, I think I would be interested to know how you would work with colleagues like myself who don't have access to alternative therapy, so that when we have a patient come to our clinic and then say, look, we'd like to trial these aspects of complementary therapies, how that can be accessed, rather than saying, well, leave it to the patient to come and access, but in turn we have an interface where we can sort of refer to you directly.
Yeah, that is what nowadays most of the doctors who are what I think they cannot get back to them their level, and they are trying to cooperate with us, a referred patient to us. We are doing that also. Other cases who are they are fed up about their treatment, they come to the alternative way also. So both way we are cope up and we are doing therapeutic way. And God is the first man. Second, we try to help them and get back there. What is the thing? There is the things I want to tell you all. The world, they are having various medication, allopathy, homeopathy, osteopathy, but patient need as a sympathy.
Yeah.
That's the main things, our empathy. This is the main word. So I prefer that healing is our part.
I agree.
We have to accept this. We need allopathic because surgery and certain things we have to work on. But the chronic illness can be, if you cannot make it your satisfaction, it can be other alternative way without any harm to the patient. You can treat them. There's nothing wrong. That's what anyway.
I think it was a very insightful and learning views of different strategies of methodologies that are being taken into, and I think it was a pleasure having you, Doctor, here today to learn more about the pain management and at the same time anesthesia and how it could contribute and is very vital for the healthcare system in our community.
Thank you very much for the opportunity.
Thank you very much, Dr. Liza and Liza. And I think we have more time. We have to travel also. So in a short time, I get to some pick your asset knowledge, and we will see you later, and we will communicate with you.
Yes,
Thank you very much.
Look forward to that.
Thank you.